said, my name's Lane Colvin. I am the administrator at Ouachita Community Hospital in West Monroe. We're part of the Glenwood network of care. In case you're wondering where we are, we're the little hospital on the service road in West Monroe by the big Pentecostal church. That's our marketing spiel that we need to do. We're a 10-bed surgical hospital, and what we specialize in is surgical procedures. We do everything from a lot of the in and outs, which are going to be your GI doctors doing endoscopies, colonoscopies, plastic surgeries. We do a good bit of orthopedics, total knee replacements, so we do have inpatient. And we do a good bit of bariatrics in addition to just general surgery. Ouachita Community Hospital started as a physician-owned organization where 10 doctors or so went together and built this, and then ended up selling it out to the main hospital. Before that, I've got close to 20, I have more years in rehab experience than I'd like to go ahead and say. I graduated from ULM, except it was called NLU at the time, in 1987 with a degree in health and physical education. Ended up getting a master's in exercise physiology. In 2003, I received a master's in healthcare administration from Trinity University in San Antonio. I've started off working at the very bottom, working for the orthopedic clinic, working in computerized testing. IsoStation B200 is what it was. It was a back testing machine that we worked with almost exclusively with workman's compensation cases. So I spent a lot of quality time in court because a lot of these cases went to court. From there, I ended up moving to South Georgia for my first management position. From South Georgia, I've started a company. I've worked in Arkansas. I've accepted a position in Colorado, and I've built a hospital in South Texas. I know what it looks like to run away from a hurricane. Did it 3 times. I'm very efficient at packing up a hospital and running away. So that's kind of a little bit of the background on what I've been doing. I came back here to take the position at Ouachita Community Hospital just because I'd been on the road for 9 years. My wife, my dogs, my furniture, and my house were all in Monroe, and I was traveling. So it was time to get off the road, so I took the position up here. Ouachita Community Hospital is part of one of the major healthcare systems in the nation. It's called IASIS Healthcare, IASIS. It's based out of, everything's based out of Franklin just about. Nashville, Franklin, all the major systems are based in that area. HCA Columbia is one of the systems. CHS is the new big player on the block. At one time, I worked for a company called Triad Hospitals, which was 55 hospitals across the nation that got bought out by HCA, if you can imagine how much that little deal went down for. So there's a lot of the systems are all based in the Tennessee market, apparently for very good tax reasons and things of that nature. But what I was going to talk to you today about is it's called the American College of Healthcare Executives. It's a professional organization that I'm a part of. It's one of the largest organizations in the nation for healthcare executives. It's very diverse. It's very far-flung as far as what all it covers. There's a lot of CEOs in this. This is kind of just a real quick overview. The American College of Healthcare Executives, the mission of the organization, or the vision, is to be the premier professional society for healthcare executives. There are members of this organization across the United States. It's a huge organization. We're big enough that we actually have full-time permanent lobbyists in Washington that don't do anything but lobby healthcare issues to the nation's Congress, to the Senate. We have an influence in Washington for that reason. If you can imagine, we have a vested interest in them to quit toying with our reimbursement and the regulations that we play with. If you've been in this field long enough, it makes big circles. I've been in here long enough that I've watched them go after skilled care, LTAC, rehab, acute care, and then they swing back around and do it again. So, I mean, it doesn't really, to me, it's never really mattered who's in the White House. CMS is the Medicare folks. That's the bureaucracy that we have to deal with. With CMS, you also, all the other insurance companies sit there and wait to see what they're going to do, and then they follow suit. But the mission is to advance our members in healthcare management excellence. They have a program that we go through as far as when you start off, you can join as a student, then you can move up as an early careerist. There's a lot of resources. We're going to talk about some of those in a few minutes about how this organization can help you. And then from there, you can go to the mid-careerist on up to the C-suites, or what they like to call it. I find that a little bit arrogant, but that's their C-suites. It's where the CEO, the CNO, the COO, the suits hang out. So that's one of the areas and how you can progress to that. Whoops, went a little too far. As an ACHE student associate, what do you get? Now, number one, let me go ahead and tell you, it's $75 a year. That's how much it costs to join ACHE as a student. That's a whole lot better, because when you become a regular member, it's $150 a year. When you get to fellow status, they like to hit us for $325 a year. That's when you also like to try to put it off on your organization to pay for your membership. But what you end up doing is you get access to the members only, or they've got a very, very robust website, ache.org, and the official LinkedIn group. It gives you access to these resources. Community networking leadership. Every year we have a big meeting in Chicago. That's where the national meeting happens. As you progress through the system, you have to pick up continuing education. They break it into two different things. One is Category 1 and then Category 2. Category 2 can be anything. You can attend a meeting, a local meeting that's talking about anything healthcare related, and you can get credit for the amount of time there. Category 1 is kind of where they make their money. They end up, it's very specific. You have to meet very specific guidelines on what qualifies, and it's either going to be 1 hour, 3 hours, 6 hours, 12 hours. 12 hours of ACHE credit sets somebody like me back, just the course registration, anywhere from $1,500 to $4,000. Because they like to have these things at really nice resorts. Apparently that's a requirement of the speakers, is you get to go to like Palm Springs and Miami and things like that. Publication in newsletters. They put out a lot of information. There's a lot of research, a lot of topics. As you progress through your system, once you graduate, your education has just begun. You've got to keep up to date on what's going on, what the trends, what's happening. If you don't stay up to date, you're going to get left because things change in a hurry. This gentleman right here can tell you the requirements that change just in medical records alone from year to year. We get big reports that come out, and what was good last year is no longer good this year. And I heard a question earlier about business office. We have to keep up to date on that because insurance requirements change. They don't call you and tell you they change. They just post them on a website. When they do that, something, say a surgery that last year did not require pre-authorization, this year requires pre-authorization. If you don't do it before the surgery, you just did that surgery for free because you cannot go back and bill the patient. I've seen that happen sometimes with a $5,000 or $6,000 surgery. It only takes one of those before people that are a lot higher in the chain than me start making really ugly phone calls to you about getting your processes down. As a student, you get reduced fees for Congress and healthcare leadership. That's some of the big, the Congresses in Chicago. Healthcare leadership is some of the local meetings. We have a local organization. There's 2 in Louisiana. One of them's called CELA. That's from Baton Rouge down to New Orleans. And then LAHEG, Louisiana Healthcare Executive Group, is everybody else. I'm on the LAHEG board. So we take up from Shreveport to the river, all the way down, and then just not that slice of Interstate 10 and 12 that goes across the South Louisiana. Of course, some of the biggest hospitals in the state are in that little stretch, but we have, that's our region, is all that area. A lot of our meetings that we have in Shreveport or Lafayette, just because that's the 2 big population groups, and we set up education sessions. I'm going to be coordinating with Dr. Dolachek and y'all's program that we will offer, basically I'm going to make sure that the course is free for y'all if you want to come over and listen to it. And you get lunch, and you get to meet people, which is a big part of this job whenever you're first starting off. Career advice and resources are also on the website. That's going to be in the packet a little bit later. And then financial assistance. There are programs out there that will help you, can help with tuition, can help with grants and things of that nature. Publication to newsletters. When you get a membership, you get automatically you get the ACHE Healthcare Executive Magazine. You get one of these. I've got a stack of things that I get every month, just a portion of what I get. This is one of the magazines that has a lot of good resources in it, and then you get to take a choice of Journal of Healthcare Management or Frontiers on Healthcare. I like the Journal of Healthcare Management. This is a research-oriented magazine. It does studies. It has some very good information, and once you get past a little bit, some of it is real, it's kind of like building a better ball bearing, but a lot of it's real good information on different processes, improvements that you can do. Educational opportunities. There is a student track at the annual Congress. I mean, y'all don't really need to be sitting in some of the meetings that say somebody that's running a major system is going to. It's going to go, but where there was the ability for students to go to Chicago at a discounted rate, listen in on some of the topics that are happening up there, and it also is a great networking opportunity. The local chapter provides continuing education. That's one of the things that we specialize in our group, LaHeg. Like I said, Lafayette, Shreveport, there's the two places that we typically do them. And then you've got the online seminars, webinars, and self-study programs. They've got a mass of information that's out there. They've got the self-study programs. Some of them are self-assessment, where you can do a study on yourself, go through, honestly answer it, and it'll help you find out what your weak areas are. To become a fellow, you typically need X number of years of experience. It really helps to go through a study group because there's a lot of areas that it covers. And not all of us can be, like, you have to be a generalist in a lot of this stuff, and you can't cover all of it. So it does help to sit down, and then you take an exam. After I pass the exam, I make sure that my continuing education credits stay up to date because I have no desire to try to take that exam again. Graduate student scholarships. You're starting your career. A lot of times bachelor's degrees will get you in the door. What you do from there a lot of times is going to require a little bit more advanced degree. I ended up, like I said, I had a master's in exercise physiology. That would take me so far. I needed to specialize more in healthcare administration. So I went through an executive program at Trinity University. And that's a very top-rated type program in this region. Very intense. If you're not self-directed, you don't want to go through an executive program of that nature just because you're going to spend a lot more. I spent more time trying to get through that program than I did for 2 years here. I mean, it's very intense, a lot of material to cover. They have different awards. They've actually got the Albert Dean Award for minority students where they offer scholarships on that. And you've got the opportunity to apply. I'm not real sure about all the different, some of these are you write or some type of paper, some type of submit an application that does help fund some of the awards. And they do have the essay competition that will help with financial assistance. The Student Association, like I said, $75 annually. You get to 5 years of Student Association membership. So even if you graduate, you can kind of pull that over for just a little while longer. And 2 years at the bachelor levels, 3 years at the master's level, so it does continue on. I know how it is whenever you're going through school. It's not like $75. It can be a significant investment in an organization. But I really feel that this is an organization that can help you progress along in your career, whichever arc you want to take within healthcare. Once you get finished with graduating, if you're in the program, we're going to know it because it gets submitted and transfer to regular member status. It just rolls over. You don't think you'd have to go online, and just it rolls over so it pre-populates. And then they throw in their pitch for ACHE Fellow. That's something that we work towards a lot of different individuals that are members of ACHE. We want to progress them on up into fellow status. And that is kind of the quick and dirty version of ACHE. Some of the other things that I think that would be beneficial to you is if you get online at the Member Center. That's this handout that I've prepared for you. This is just me copying stuff off of the website. I went out and found some stuff that I felt would be helpful as a student, things that you can find that you're on there. There's a whole section that's just Member Center. This requires a secure logon. So once you put that in, it gives you access to the ACHE website. A huge, huge thing that they offer is a job board, a very robust job board that you can go on and see who is advertising across the nation. So that is, it's sometimes, it can be difficult. I did not include a copy on how to get to that part of it. I just kind of stuck with the member centers part of it. But the job board is to me, is almost worth the cost of the membership. Because I've had opportunities when I needed to utilize the job board extensively. So, I mean, it's nice to have access to it. Also, at one time I was having a little problem with, getting interviews. I was looking at one time. What I ended up doing is I took my resume. For a fee, I submitted it to a professional resume reviewer. He tore it apart, sent it back to me. I made the changes he wanted to make. We went back and forth until I got my resume to the point where it said the right words. Trust me, Keywords make a big difference in these resumes. What your experience is, what you've accomplished, where you've been, just the verbiage, the way that they put it, and that's a service that they offer. They also have a resume bank that once you are comfortable with what you've got, you can actually post your resume to that part of the website, and people have the ability to go out, because not all jobs are posted. Sometimes people have an opening and they just kind of go out and they're looking for somebody and they don't want to advertise, and they scroll through looking for people that have the qualifications that match what they're looking for. So you can become the graduate student associate. That's mostly set up for the folks that have already graduated. They're in a master's program or a PhD type program. And then a student associate, we've kind of covered a good bit of that, but it has different parts of the website that cover that. I talked about there's a directory of postgraduate administrative fellowships. There's a list of the different places out there that offer fellowships. If you have your choice between getting a fellowship that pays and one that doesn't, I highly recommend getting one that pays, because most of them don't want to pay. They just want to offer the fellowship. The Resource Center, there's a section set up, Career Management 101, your career as a healthcare executive, what you need to know to start off. Unless your dad or mom owns the company, do not expect to walk into a hospital or healthcare organization and be the top dog right off the bat. Most of the time you're going to have to pay your dues a little bit. Start, work your way up, learn the field. It's a very diverse field. Like I said, I've been doing it 25 years and I still feel like clueless some of the time, trying to figure out what's going on out there. You have to figure out what's going to be your specialty. I thought those were excellent questions earlier on the business office. The business office is a very big, broad area. I've got a specialist in insurance, not just one, multiple specialists. I've got one person that handles my commercial insurance. I've got one person that just handles Medicaid. I've got one person that handles the Medicare portion of it. The rules are all different. If you don't know the ins and outs of the system, these people can cost you a lot, or these programs can cost you a lot of money. The government or a lot of these insurance companies' favorite thing to do is go, deny. Something's wrong. It's in the wrong place. Deny. It's a lot easier. You have to jump through the hoops then, resubmit it. If you don't do it in a timely manner, which they determine, and they're all different, deny for good. So, I mean, you have to have people that are specialists in that. That doesn't necessarily require a degree, but it does require an understanding on your part as a healthcare executive that there are specialists out there that you need to work with. You need to invest in their continuing education because these rules change all the time. The Employment Service Job Bank and Resume Bank, ACHE Diversity Internship. Diversity is a huge portion right now of ACHE. There's postgraduate things. And then it drops down to the publication and newsletters. We talked about some of those that ACHE offers, the Healthcare Executive, the Journal. I am going to bounce through this. I put it off like 15 pages of this stuff. Educational opportunities, student track, financial assistance. There's a whole section in the ACHE website about the different offers that they have as far as financial assistance. Networking. I can't stress networking enough. A lot of times, it's not what you know. It's who you know and who they know. Is a lot of how this stuff is done. I mean, education, skills are going to get you so far, and then you have to develop your own network of people that you work with. That's very important. Don't burn bridges. Even if you really, really want to, don't burn bridges, because sometimes those people can come back and help you. Student networking tip. I like that. I wish I would have had something like this whenever I was going through. I like the one about pay close attention to people's badges. See what they are, see who they are. When you're in a networking session or you're in an opportunity to know who the players in the room are. And also introduce yourself. Look people in the eye. Give them a firm handshake. People remember that. One thing I will recommend, and this is just, I'm not trying to be preachy or anything else, but when you come to one of these meetings, put these up. They doth annoy us. But I mean, that's just a good etiquette thing in one of these meetings. If you're trying to have a conversation with somebody about a job and they're looking at their phone, you're not going to get a job with me. You are not going to even get an interview with me. So take the initiative when you first start off. It's up to you. I mean, it really is up to you. Take the initiative. Be prepared whenever you go to a meeting with. And special interest group. This is one of the ones, this is a whole section. There's a section in the system that is geared to different people. There's a CEO administrator group, a group practice executive. That's like running doctor's offices. Healthcare consultants. People, there's a whole industry out there that do nothing but make recommendations to us in healthcare, whether it's how to pass an accreditation or different service lines that we don't do. A lot of things are now outsourced. Where doctors used to like to be independent practitioners, now there are groups of people that will provide you with the doctors in your emergency room, hospitalists in your hospital, anesthesiologists. These are all consultants that you have to deal with. Managed care executives. Managed care is all your insurance companies. There's a whole area targeted just to what they're working. Nurse executives. Any nurses in here, teacher-wise? Good, let's talk about nurses. All right, your biggest group in the hospital is your nurses. They're hard to find a lot of times, and really it's one of your highest expenses. And it's something that it's very difficult. You have to be able, nurses are clinical people. Clinical people, a lot of times their opinion is the only person that can manage a clinical person is somebody just like them. It's just a bias that you have to work with. And deference to Dr. Dolachek, PTs are also, I know she's not a PT, but they're also very similar to that. But, I mean, it's a big group of people. You have to be able, as an executive, to walk two different worlds. You have to be able to talk clinical to them, and you have to be able to talk business office. So, I mean, you have to know a little bit of both of these. And it really helps when you're especially working with large groups of nurses, because one thing I've always heard, you don't understand what we do. If you have some credibility in that where they ask you a question and you respond in a manner that they're used to, it does help to have a little bit of clinical knowledge to be able, you're not going to have to know how to run a catheter or something like that, but I mean, just be able to understand what nurse world is. Okay, physician executives, that's a new kind of, a lot of physicians have gone off into the work, they've joined the dark side, as a lot of them say, and joined the executives in the hospital. Post-acute chronic care executives. Post-acute world, you're thinking your SNFs, LTACs, rehabs, chronic pain or chronic care. There's a lot of, that's a new market, not a new market, but there's a whole section just dedicated to that. Rural healthcare executives. We can break it down between urban and rural because there's different rules for the rural healthcare executives. If you're a critical access hospital, you play by a little bit of different rules than you do, say, here in Monroe. And system healthcare executives, because managing one hospital is different than managing 30. So, I mean, they've got a session just for that. Some of the links they've got, the next thing I included was just a whole section on acute care. And that world changes on a regular basis. Didn't want to run long. So I've included some information because healthcare changes. It is a dynamic field. It's actually, some days you want to beat your head against the wall. Some days you walk out the door and just kind of, yes, got it. But it's always challenging.
Go the distance without going the distance. Online learning with the University of Louisiana at Monroe. ulm.edu/EULM.